Hello, everyone. Welcome. We're excited to chat with everybody today. I'm here with Amber Coates, and we're going to talk a little bit about egg donation. And I think Amber you should be able to see her here in 1 minute too.
Thanks, Dr. Broughton. I'm just having a little bit of a challenge getting my video to turn on.
There we go. Always technical.
There we go. Thank you. Thanks for joining us. I'm the director of our Intend and AsiaWest egg donor programs. And just so you know, we are an affiliated company with with Northwest Surrogacy. And of course, we partner with Dr. Broughton and her team a lot.
Yes, I'm Dr. Darcy Broughton, and I'm one of the reproductive endocrinology physicians at Pacific Northwest Fertility here in Seattle. Yes, and exactly like Amber said, we feel very lucky to work with Northwest Surrogacy really frequently, and we're excited to chat with you all today a little bit. I think, Amber, do you want to get started and then?
Yeah, absolutely. So egg donation is an interesting thing. There's a couple of ways that you can go about finding an egg donor, right? There is fresh cycles, which is what AsiaWest and Intend really focuses on. And there are frozen egg donor options that you can do, which often come directly from a clinic or with an egg donor bank. We specialize in working with families to find a donor sort of directly if they're not able to find a frozen option within their clinic.
Yes, and on the clinic side, we are often working with folks like Amber with an agency situation. A lot of clinics will have an in-house donor egg program as well, so they might recruit and cycle their own donors. And so that's just potentially another option for patients. But like Amber mentioned, if they're looking for something super specific, they might potentially be wanting to talk to an agency, and we're happy to work with agencies as well. An important thing too is to definitely find a fertility clinic where you're comfortable and you feel a good connection with the folks there, since they're going to kind of be guiding you through the whole process, potentially with an agency and potentially a surrogacy agency too, if you're planning to use a surrogate in future. And so I think Amber's going to talk a little bit about donor selection a little bit down the road. What we do on the clinic side when we first meet and chat with couples is we're obviously talking about reasons for using an egg donor, talking about the different types of egg donor programs and which direction people might want to be going in. And then we're doing a little bit of testing on the intended parent side so that they can use that testing to help guide their selection of an egg donor. And the most important thing really on the testing side is to potentially screen whoever is going to be providing sperm to see if they're carriers for any recessive conditions. So things like cystic fibrosis or other diseases that potentially run in families, to make sure that the sperm provider and the egg donor are not carriers for the same conditions. So that's really an important piece of pre-cycle testing that we're doing. There's other testing that's involved in IVF on both sides too, depending on whether there's a partner that's planning to carry or whether we're potentially using a surrogate down the road. So that depends a little bit. And then Amber chatted just a little bit about fresh versus frozen. And I think that's something oftentimes people have questions about. And a lot of in-house donor programs will potentially work with a frozen donor egg bank to offer that options for patients. And some clinics actually have their own frozen donor egg bank. And we're lucky at PNWF that we cycle and freeze eggs here for our own patients, which is fantastic. And sometimes with frozen eggs, it will be a situation where you're allotted a certain number of eggs or potentially embryos at the end of the process, versus a fresh donor, which Amber's going to talk more about, where that's a prospective process where the donor is cycling and you're getting eggs from that retrieval to make embryos. And there are pros and cons of both, which we'll be kind of talking about along the way. Some of it might have to do with cost. Some of it might have to do with the donor that you're looking for. Some of it might have to do with the goal of your family size, depending on how many eggs you can get from a frozen bank versus generally getting more eggs potentially from a fresh cycle. So if you're wanting multiple kids, fresh might be the way to go. Also important to think about whether or not we're using multiple sperm sources. So if we have families that, male couples that potentially might be wanting to split the eggs between two sperm sources, then it might make sense for them to get more eggs potentially with a fresh cycle. So it's kind of a little bit of the nuance between fresh and frozen, but the fertility doctor and potentially the agency will also be helping you kind of figure that out.
Yeah, I think that it's important to note too that Fresh cycles do tend to be a little bit more expensive than a frozen cycle. But to your point, you do get all of the eggs from the retrieval. So hopefully if you do need to have more eggs due to having multiple sperm samples, or you just are hoping to have, 2 or 3 children, it's going to be to your benefit to have a single egg donor. That way, all of your children sort of are all siblings. I hear that a lot when I speak with my families. The other thing that we really kind of see a lot of is if you have very specific things you're looking for in your egg donor, if you're looking for very specific ethnicities, if you're looking for education levels from certain types of schools, fresh donors do tend to be where most families go to, because you do have a little bit more options because you are taking the donor through the entire process. And so you're selecting the donor first, where with a frozen egg bank, the donors have already been through the process, so it's faster. It does tend to be a little bit less expensive, but maybe you won't have as many eggs available to you, or you're kind of limited to just the donors that have already cycled. So just depending on your timing, if you have a little bit more time that you can wait for a 4-month process to happen, or if you have specific needs, then coming to somebody like me and looking at a fresh cycle is going to be probably more what you want to do. Or if you're a little bit more financially sensitive, maybe really looking at the frozen options is the way to go.
Great.
Selection, I don't know about you. I was just going to talk a little bit about the egg selection process and sort of the screening. The other benefit of doing a frozen is a lot of the egg donor screening has already been done, like Dr. Broughton explained earlier. But once you pick a fresh cycle or a fresh donor to go through a cycle, then we really start looking at getting the donor screened. And so the process takes about 4 months to get through. The first 8 weeks of it is going to be medical clearance. And this is where we get the genetic carrier screening done. That's done through the clinic. We'll have them do a psychological evaluation to make sure that they're psychologically sound. We have them do a family medical history risk assessment just to make sure that you really understand what the family's medical or the donor's family medical history looks like and what the potential risk is to your child. And then they'll also do some blood work to make sure that her fertility indicators are there, where the AMH looks good. They're going to do a infectious disease panel. They're going to do a drug panel. They're going to do just an overall health check on her as well. And then an ultrasound, really taking a look at her follicle count. With a fresh donor, this is going to be a really important piece, because if you do want multiple children, or you're going to do a split cycle, it's having a good follicle count is going to be indicative of whether or not you're going to get enough eggs at the end, hopefully to serve you right. So it does take about eight weeks to get through. And there's a lot of opportunities in this that we might end up having to rematch you with a new donor. So that's another risk with a fresh cycle. Is just, this is a human process. And so as we're going through this, the donor might get disqualified as your donor, which we would need to find you a new donor then. So again, timing is a lot of things with fresh cycles. There's a lot of benefits, but there's some areas where it can be challenging.
Yeah. And that's a perfect segue. There was a question in the chat too, just about kind of the timing of choosing an egg donor versus kind of chatting about the surrogacy process and signing with an agency. And Amber might have some insight into this too. Oftentimes, obviously, we need the embryos first before we're, ready to put an embryo into a carrier. And so we always sort of recommend that we move ahead with the embryo creation process as soon as people can, so that we really are able to have embryos banked and in the freezer. I think surrogacy agencies differ in terms of how they potentially, when they want embryos to be ready. I know almost everyone wants to have embryos before that match happens, but we also know that the surrogacy process can be lengthy, and it can take a while to kind of find that match. And so we always recommend that people are meeting with folks like Northwest Surrogacy early on in the process, even while they're picking an egg donor and undergoing the embryo creation process, to get the ball rolling and kind of moving in tandem on both of those things, if that makes sense.
Yeah, I would agree with that too. We always tell people, the larger surrogacy companies that do a lot of pre-screening are always the best choice, like Northwest Surrogacy, where they do a lot of the pre-screening. So they know their surrogate is a really good candidate, but that means that there's going to be a slightly longer wait time to wait till you get matched. And so when you're looking at a 10-month wait, it's good to sort of get started with them and get that timeline going at the same time you're selecting a donor and getting embryos created. Because by the time we get through the 4-month process, and if you do have to rematch, it just gives us a little bit of buffer, but also knowing that you're just a few months away then from getting matched with the surrogate. It really does kind of go in tandem. And we also will keep your surrogate agency sort of advised on how things are going with your process, and let them know when we have calendars and when we expect to have embryos, so that everything goes as seamlessly as possible.
Mm-hmm. Yeah, it's a lot of coordination between potentially the agency and the fertility clinic.
Right.
And another just question here about having to, do you have to travel to the clinic as an intended parent during this process? And generally we're able to expedite that. A lot of the consults with the fertility doctor and potentially with the agencies will happen on telemedicine now, which is great. And so you're not necessarily traveling into the clinic for that, but we do need to get sperm to the clinic when we're using an egg donor to have that sperm here and available when the egg donor comes through. Oftentimes we're able to consolidate things into maybe one visit, right? So that people are coming potentially to the clinic just one time to do their testing and potentially provide a sample and get a sample frozen. And so we're hoping it's not a ton of back and forth to the clinic, but it generally involves at least one visit.
Dr. Broughton, when you have a family that's out of the country, how does Pacific Northwest Fertility handle sperm donation in that process?
Yeah. I think, again, we're trying to coordinate just a one-time in situation, Amber, right? And kind of getting as much done with one visit. We're not seeing a ton of international patients now, but we're hoping to really expand that. And so our goal is to make it as streamlined for people as we can. But usually, clinics call it different things, like a 360 visit or kind of a one day testing visit where we bring you in and potentially get sperm here. There can be challenges with potentially getting sperm, from outside the country. And so coming and providing a sample here is the easiest thing to do.
Okay.
Yeah.
It can be really expensive too, to ship in.
Absolutely. And oftentimes if we can coordinate just everybody just come in one time, we can make it pretty seamless.
The donor, just to kind of jump on that question as well, the donor does most of the traveling, right? They're going to travel if they're not in Seattle, like if they're working with Pacific Northwest Fertility, they're going to travel for that initial office visit. And then they're also going to travel for the second portion of their medications, right? So the first week they'll do at home. We'll find a clinic that's local to them to do the monitoring for Pacific Northwest, but then they'll fly into Seattle probably on day 7 or 8, and then the final monitoring, and your team will do the retrieval. So the donor takes on most of the travel.
Yeah, that's exactly right. And exactly that process for the donors is about a 2-week process of them, doing injections to grow multiple eggs on the ovaries at one time, and then having just a little surgical procedure with us at the end of those 2 weeks. They're generally able to travel home pretty quickly after their procedure. And we're going to take those eggs from that egg retrieval, obviously a little bit different if we're using frozen eggs, but the embryo creation process is similar in the lab, where we're inseminating eggs with sperm to make embryos. And then we're growing the embryos in the laboratory over the next 5 to 6 days. And we hope that the cells are dividing and that they become a beautiful blastocyst on day 5 or day 6, which is an embryo that we can freeze, that we can use potentially in an intended parent or in a surrogate in the future. And one decision that families need to make during this whole process is whether or not they want to invest in genetic testing of the embryos in terms of looking at the chromosome balance. And we call that, you see that on the slide here, as PGTA, which is pre-implantation genetic testing for aneuploidy. It's quite the mouthful, but it basically is a double check to see if there's a normal number of chromosomes in the embryo. And that's testing that you chat with your fertility doctor about kind of pros and cons of doing that. The great thing about doing egg donation is that the egg donors are young and they have really good egg quality. So we expect hopefully the majority of their embryos to be balanced with their genetics. But families still might opt to invest in that genetic testing, especially if they might use a surrogate in future, so that we really know that that embryo that's going into a surrogate, which you're investing a lot in, has a chance of kind of being a baby. And so that's a nuanced decision making that happens with the fertility clinic. But if we decide to do the testing, we'll take a little biopsy off the edge of the embryo before we freeze them and send it off to that genetics company that will tell us about that balance. Once the embryos are frozen, they are frozen indefinitely. And so we can use them potentially, a couple months later, we can use them 10 years later, which is nice when you're thinking about potentially planning your family down the road in future.
How long does it take usually to get that testing back?
Yeah, generally 3 to 4 weeks. depending on the testing company that the fertility clinic uses. But I think, Amber, you touched on this a little bit, and I think an important part of understanding IVF, and you talked about it when you were talking about getting eggs with a fresh donor, is just the drop off that happens between eggs and balanced embryos, or embryos that we're able to freeze. And that's something that's really hard to understand initially when you're learning about this. It seems like every egg should be able to be a baby, but there's a lot of drop off that happens in the lab because not every egg is going to fertilize with sperm. And then not every embryo that we create is going to be able to make it those 5 or 6 days in the laboratory. And then not every embryo that makes it is going to have that balance of chromosomes. And so that's why we're lucky, especially when we do fresh donor egg, that hopefully we're starting with a really good number of eggs so that we, even with that funnel, you know, we're ending up with a good number of embryos at the end.
Is there, and I get this question a lot from a lot of families, and I always have kind of a vague answer, but you know, that one of the things they ask, is there like an average number of embryos you can expect from a certain like number of mature eggs? And I often tell them there's a male factor involved and just a pure DNA mix involved, but can you answer that maybe a little more astutely than I do?
Yeah, I always hedge on that question a little bit too, Amber, because eggs are only half of the equation, as you mentioned, and every combination of egg and sperm is different in terms of how that embryo development is going to go. I would say that in general, from a fresh donor cycle, you know, we're often ending up with more than 2 or 3 embryos at the end of it, which is great, but it is variable. And it also, if you're in a situation where maybe you're getting all the eggs from a retrieval, potentially, then it might vary based on the number of eggs that you're getting from that donor. So I wish there was a cut and dry sort of drop off that happens, but it's just a little bit variable.
It is, for sure. There's a question that I want to kind of adjust a little bit in the Q&A. It says, what kind of info do I get about an egg donor before I make a decision? And I think it's pretty consistent from agencies and clinics. I mean, I think we actually use the same platform as Pacific Northwest Fertilities, but you get a lot of information, honestly. You're going to get photos of the donor. You're going to get her education background. They've got some information about their height and their weight. Some basic family medical histories shows up on their profile. They have essay questions where they answer to give you kind of a sense of who they are. And then, of course, donors, depending on how much screening has been done, if they've donated before, will at least have AMH levels, will at least have some basic health information on her. If she's a proven donor, then we're going to have previous cycle records. We're going to know what her genetic carrier screening looks like. We're going to know what, you know, her follicle count was, how many eggs were retrieved. Sometimes we have embryo information. Contact is there. Usually what the donor prefers is also listed. That's another question on the profile, but I always check, right? I always tell families if they really feel that it's important that they have open communication with the donor. Even if the donor indicates that they want an open communication, I always reach out to them just to make sure. Donors are young, they're people, they sometimes change their mind. They also sometimes decide to be able to do open, even if they didn't indicate that. So I always just tell families to let me know ahead of time. But there's a lot of information that you get to learn. I also encourage families to tell me if they have additional questions, because I will reach out to the donors. I'll ask those questions for them and get the answers to them. Sometimes we even have little videos from the donors to kind of give you a sense of their personality, their voice, what they look like in animation, which is always helpful.
Yeah. And I would just say that I agree, or I think most of that is pretty consistent, except the only thing, obviously, if you're using frozen eggs, is that information has kind of already been collected, so there might not be that ability to necessarily go back to the donor. But I think, just in case Amber brought up proven donors, and generally what that means to us is that there's been a pregnancy from those eggs before. And I don't know, Amber, if you get this question a lot, but I always get asked, should we choose a proven donor, right? And does that feel really important? And I never discourage people from using a donor where it might be their first time through, just because a lot of screening goes into selecting donors. And I think Amber's going to talk a little bit about, reasons why you might have to rematch, but for the most part, we're selecting donors that we think are going to be great candidates. And a lot of donors are first-time donors. And so I would never want people to necessarily not pick them because they haven't been through the process before. They still have it. It has a great prognosis for working quite well. Some people really want that reassurance of a proven donor, and I think that's fine too. But that's generally how I counsel people, Amber. I don't know if you feel differently.
No, I think that's exactly right. And we often tell people that in our pre-screening, we look at the indications. We look at the AMH levels. They are the right age. We know they're healthy. So all the indications are there that they're going to do well. Now, that's not a guarantee, right? Sometimes donors don't stimulate well. Sometimes we don't get the numbers that we expected to see, but that is also part of the screening process, right? That's why we get a follicle count. That's why we recheck the AMH. AMH varies, and I find that it actually varies in a donor from one point to another, right? So there's points in their cycles, their menstrual cycles, that AMHs are a little bit higher. There's also some outside factors that might, birth control, things like that. But, there are fresh cycles, 80% of the time, a match is great the first time, whether the donor is a first-time donor or a proven donor, right? She goes through it just fine. A proven donor does, increase your odds to making a match work all the way through. But there are times that a proven donor can even maybe not work out. Genetic carrier screenings, for example, are something we're seeing a lot, where the panels are getting expanded. So where maybe the donor had 174 done, but now they have a new one that's over 500 conditions. And so when they do that, it might disqualify them as your donor. If the donor's on birth control, it can affect the follicle count. And so maybe the donor's follicle count isn't what it needs to be this time around. So even proven donors can have some bumps, but we definitely have some built-ins to kind of, with rematching and setting you up as a priority for rematching, to kind of help lessen the burden of trying to find a new donor. But we do everything we can to make sure that the first-time donors are good options. And then we do screening to kind of just confirm as we go along. So I would never discourage somebody from picking a first time.
Yeah, I think it's always good to know how much work goes into the screening and selection of the donors before they're ever kind of visible to the intended parents. Yeah. And we always tell people with our, in-house donor egg program, we kind of only accept, 4 or 5% of the people that apply to be donors in, because people have, we have high thresholds. We want just really good donors and people to have really good outcomes. And so a lot of that legwork has already been done for you, which is our job in the whole process.
Absolutely. Well, and I do have to say that you guys are an invaluable resource for us too, when we run up against a donor that is a little bit like, we're not sure, right? We're not doctors, so we have to make sure. So your team is always quick to answer our questions and make sure the donor would fit your eligibility.
Mm-hmm. Absolutely. Because obviously we're wanting to keep the donor safe and healthy through the process, but also keep future offspring healthy and, build really healthy families is the goal. A question in here about the donor sibling registry. And the donor sibling registry is kind of an online consortium of people that are donor conceived, or families that have children that are donor conceived. It might be donor egg or donor sperm. I actually think there's more of a donor sperm presence now on donor sibling registry, but it's a way for people to potentially find half siblings that have potentially used the same donor in the past, and to be connected with those people. And oftentimes that's been through like donor ID numbers and things when you're talking about donor sperm. And so obviously some people that feels important to them, and potentially to investigate that. And I think that it used to be more of an opportunity for connection before we had more open ID donors. And now that the more donors are open to potentially being contacted by offspring in the future, then there's kind of less maybe air of mystery around this, and kind of we think that's a good thing in the donor community. I don't know, Amber, if you have anything to add to that. But
yeah, we encourage this a lot, because there are some studies out there that show that the more information a child has about their donor, just like within adoption, it just makes them feel more secure, and it takes away a lot of negative connotations. So we encourage the donor sibling registry at a minimum as much as we can.
Yeah. Yeah, I think it's definitely trending in a much more open situation for donor conceived children, and which is a wonderful thing and probably very beneficial to mental health and things moving forward. We got a question about cost. Yeah, just how much does it cost to use an egg donor? And Amber and I had actually talked about whether we were going to chat about this. I think the tricky thing is it's a little variable, and from whether or not which clinic you're potentially using, which agency you're potentially using, whether you're going with an in-house egg donor pool from a clinic or whether you're using the help of an agency potentially can affect costs. I think in general, what Amber said is true. It's usually a little more expensive to go the fresh donor route, where you might potentially be getting more embryos from that scenario on average than a frozen egg route, where you might get a smaller number of eggs, smaller number of embryos. So yes, I think cost can be variable, and I would say we can kind of give a ballpark, Amber, anywhere using frozen eggs from, probably $25,000 to kind of upwards of $40,000, $50,000 with fresh donor egg.
I would actually probably, if you're using a specialty donor, I'd probably move that up to about 60 to 65,000. If you're looking for an Asian donor very specifically, their expenses are quite a bit higher, just because they're harder to find, right? Travel is also a massive variable as well. You find somebody that lives across the country from wherever your clinic is, you're looking at a lot more flights and expenses there than if you were to pick a local donor. So it's all something that you just need to speak with the agency about all costs. And we're very transparent. We give you a trust estimate, so you're very aware of what all those costs are going to be.
Yeah. And hopefully fertility clinics would do, the fertility clinic should be transparent with costs as much as they can be too, so that you have a real sense of that. And we also have really great billing team that helps people with that too, and just kind of outlining costs and when things are due and all of that.
Right. Yeah. So the last question that we've got, I think we're kind of running out of time, is what advice would we give to an intended parent just getting started finding an egg donor and making embryos? I always tell people to find people that you trust, find a doctor that you trust and a team that is communicative. When you're picking an agency, it's not just about the donor, it's about their process and their transparency and what kind of screening do they do? What do they verify? I think it's really important that you just do some diligence and just really trust your gut and find the doctors and people, experts that you really can trust and have your best interest at it, which is why we're pretty picky about the clinics that we partner with. But it's really the most important thing because this is your family.
Mm-hmm. Yeah, I would certainly agree with all of that. The other thing I would say is don't be overwhelmed. It can feel really overwhelming to build your family with donor egg or with surrogacy, because there are a lot of steps involved. And I think the most important thing is that's what we are here for. And we help people build families this way every day. And so don't let kind of fear of the process stop you from moving ahead. And because we're really want to be kind of beside you through that whole journey.
Yeah, I would agree with that. I think that that's exactly why you're paying an agency, whether it's a donor agency or a surrogacy agency, is to handle the logistics. And then the clinic has an entire team as well that handles third party, that knows how to handle donors and their agencies and surrogates and their agencies. And there's a lot of people that are there to do all the work for you.
Yeah, absolutely. Great. Wonderful. Well, I hope it was helpful. We loved chatting about, we love egg donation, obviously, and helping people build their families in this way. So, so yes, we encourage you to just reach out to us. I think we have one slide with contact info, right?
We do. It's right here. So if you have questions, or if you're looking into this process, or you just want access to our database, or to talk to Pacific Northwest, Dr. Broughton, about kind of what the first steps are, here's our contact. Please feel free to reach out to us. We love talking to people. We love being a resource for people. Even if you're in the very beginning phases, I would encourage you to reach out.
Wonderful.
Right. Well, thank you so much. It was nice to see you, Dr. Broughton.
You as well, Amber. Thanks a ton.
Right. Have a good day.
All right. Bye-bye, everyone.
Bye.